Welcome back to the Running Explained podcast. Hi, I'm Coach Elizabeth, and I'm here to break down the science of running in a way that actually makes sense. Whether you're training for your very first race, aiming for a new PR, or just trying to be a more balanced runner, this podcast is your go-to spot for all things running. At Running Explained, running is more than just about logging miles. It's about becoming the best version of you. That's why we talk about more than just improving your fitness, but how to support your physical, mental, and emotional health too, so you'll see improvements that go far beyond race times. And if you're looking for more support, I've got you covered. Whether you're interested in one-on-one coaching, following a structured training plan, or joining our supportive group coaching, I've got options to meet you where you are and help you level up. Ready to dive in? Let's go. Welcome to this week's episode. Super excited to have you here. My guest this week is returning guest, Dr. LaPierre, physical therapist, runner, and coach. And she's been on the show before to talk about knees, your knees and running in 2 episodes, because knees are a very hot topic. And this week we are talking about ankles, specifically ankle sprains, how to come back, how to navigate, how to deal with, how to move forward from an ankle sprain, whether that occurred when you were running or you happened to sprain your ankle doing a different activity, but now you're kind of wondering, how is this going to impact my running? We talk all about that in this episode. But before we get started, very exciting announcement. The Running Explained Road to Race Day Philadelphia program registration is open. What is Road to Race Day? Road to Race Day is a small group training program with multiple coaches. So a lot of coach to athlete, good ratios, where we are offering essentially a really, let's say, community-focused, intensive race-specific training experience for the Philadelphia Marathon and Half Marathon. It is a 4-month program. It starts in August. There's a bunch of really cool things that we haven't done before, like, race-specific weekend in-person events. There's program swag. You get semi-custom training plans. You get a ton of support, ton of education, and a very cool addition is you get a lot of dietitian support. Stevie Lynn Smith is the dietitian for this program, and so that is a huge component. Anyways, if you want to learn more, go to runningexplained.com/road to race day, and I hope to see some of you in Philadelphia. Let's get started. Lauren, welcome back to the show. How are you?
Thank you for having me. I'm so excited to be here again.
So, previous guest, give us a quick reintroduction and tell us, who are you?
My name is Dr. LaPierre. I am a physical therapist. I am a running coach, and I kind of call myself a running rehab specialist. I pretty much exclusively work with runners now in my business, the Personalized Running Doc. And I have different programs that are based off of looking at acute care as well as performance goals or strength training. Pretty much anything in between that people are looking for to be able to run longer, stronger, happier. It's a big joy of mine.
And you've been on the show twice before talking about running and your knees.
Yep.
No running is not bad for your knees, part 1, and no running is still not bad for your knees, part 2.
Yep.
And today we are talking about ankles, not knees. But before we get started, I want to talk about something, and then I want to ask you 3 quick questions, because that's what we do on the show now. But I want to ask you, you're not just a physical therapist, you also host run retreats. And I know that because I was a guest coach at your retreat last year.
Yes, that was so special. I was so honored when you said that you would come. I was literally kind of awestruck, because even though we had met before on the podcast, I was like, oh my God, she's coming to the retreat. And I know everybody enjoyed your talk so much, but yes, Revive Running Retreat. It is a female running retreat in September. This year, it's September 25th to the 28th. It's on a beautiful beachfront home in Cape Cod, specifically Dennisport. And we have private access to a beach right outside the home, which is beautiful. We have a hot tub, which is great. Outdoor shower, which I heard was amazing. I actually didn't get to use it because I was just busy running around for everybody. But I heard the views were amazing from it, and it actually had really good water pressure and hot water and all of that. But yeah, it's it's kind of like my passion project that I decided that I wanted to jump into after working at a couple of running camps for kids the past couple of years before I started it, simply because I saw like how much joy these kids were having from making these connections, that I wanted to create a safe space for females to be able to do the same, as well as for them to be able to learn more about running, whether that's specifically about like the female physiology in running or just basic training concepts, which is what we're going to kind of prioritize heavily this year. I always get feedback from the participants as well as the coaches in terms of what people want to see more of. And so we put that into the schedule this year. So we got some jam-packed days, but all of the things that people were wanting to learn more about in terms of like one-on-one coaching seminars and then group seminars as well. We have more yoga this year. The first day we'll have yoga, and after the long run, there'll be yoga. And yeah, just so many we're going to have like runs from the house, long run on the Cape Cod Rail Trail, which is really kind of like easy to navigate and also beautiful.
Gorgeous and very flat, which is nice.
Very flat. Yep. We actually have to seek to find hills in this area. So like anybody coming from a hilly area will be reprieved. Anybody training for Chicago during that time would be like, it's great for their long runs essentially to prepare for that, which we had a lot of people preparing for Chicago last year that came. I know that's always a concern that I get. They're like, well, what about my training? I'm training for Chicago, or I'm training for a marathon. And like, we'll figure it out. We'll work with you. And no one ever runs alone. Everybody always has a buddy. And again, people worry about pace or experience. Our paces ranged from, I think, like 8:30 to 9-minute like miler people to 15-minute to 17-minute mile people last year. And no one was ever alone. Everyone always felt included. Everyone always felt like everyone was cheering for each other, which they were, especially during the scavenger hunt that we did. That got super competitive, which was great. But yeah, it's such a special weekend, and was so honored to have you there. And the talk that you gave, everybody loved it. Everybody learned so much from it.
Well, I mean, I can vouch. It was a ton of fun. I was very happy to be there as a guest coach, and the scavenger hunt was so much fun. There's a fire pit. We did s'mores one night. Yes. It was just a really nice time to just spend, like, it felt like a little like mini camp, right? Like being away at camp, or if you ever grew up playing sports and went to like swim camp or soccer camp or lacrosse camp, like it was like that. It was super fun.
Yeah. And the house has a couple of different like options for rooms. So we have private rooms for people that don't want to share a room with another person. And then we have a big group room that's actually on the 3rd floor and actually has the best views. I will absolutely say that. I tell that to anybody that's looking at those beds, that like you actually have the best room in the entire house for views, aside from like essentially the, I don't know, like the coffee seating area that like we would always have breakfast at. But it looks right out onto the ocean. It's gorgeous. So there's different types of rooms depending on budget, depending upon preference. We offered shared group rates as well. And this year, something that we're also doing is day passes for those that are local, because there's some people that either I've had teachers in the past or even just like coaches, that they're either obviously in school during the weekday, so they can't come for the entire weekend, or they are coaching, and so they have to be there for their athletes for like high school or college, and they want to be able to come on the weekend. So now we're offering day passes Thursday through Saturday for anybody that's in the local area that's interested in it's pretty much all day. It's whatever the start of the day is for that day to the end of the day. Thursday is technically a half day because that's the day everybody arrives.
And if people are interested in learning more and signing up, where can they do that?
I will give you the link to throw into the show notes. It's thepersonalizedrunningdoc.com/revive/running/retreat, I believe. That might be wrong though. I don't know it off the top of my head. I probably should. But I will make sure to send you the link so that you can put that in the show notes.
All right, listeners, if you're available that weekend. It is super fun. I'm going to be there
Yeah.
and we're going to have a heck of a good time for 2025.
Yeah, I should say that the other coaches that are coming, we have Carolyn Stalker, who is a registered dietitian. So she's great to talk to if you have like essentially fueling concerns and getting kind of like some insight in that. We have another coach from My Stride that will be there. The yoga teacher is actually also a triathlete. So if we have any multidisciplinary athletes, she would be great to talk to and like learn from. She's been in the sport for years. And then myself and actually my partner, Jordan, we're both physical therapists, and we will also both be on site for essentially any injury prevention or injury questions, or some soft tissue work as well.
Soft tissue work, meaning like I just saw you give people massages. So I was like, oh, that sounds really good.
Yeah. And then
therapeutic,
Jordan
it's clinical.
Yes, very much so. And then we also did, Jordan is dry needling certified. So that's a type of technique that utilizes essentially acupuncture needles, but they don't have any medication in it, which is why it's called dry needling. And it's essentially the Western medicine's version of acupuncture, where instead of utilizing like energy points and meridians, we utilize the anatomical model and understanding of essentially muscle placement and things like that. And it allows essentially like almost a lock and key release to your muscles to essentially improve pain, improve blood flow, improve muscle activation, all these good things.
Okay. Tangent question. We haven't even gotten to the ankles yet. So dry needling, obviously, I'd say like, so dry needling really works?
Yes.
I think a lot of people have questions about this because there are some therapies for injuries that kind of seem like maybe you're just lighting your money on fire, but dry needling is not one of them.
So it definitely depends on the provider and how the technique that they learn to do it. There are different techniques with dry needling, and some people have like, I have worked with some people that I've referred to Jordan to have these things done because he is certified and I am not. And it really is like what I tell people is like a breakthrough type of kind of assist to like, say somebody has been working through an ankle injury. We'll just go that direction. And they're like, almost the way there, like it's just like the muscle just like won't release. There's some kind of like almost like block that's preventing it from tolerating 100%. And you're like really close and you just need like a little bit of an assist. This is a great therapy instead of like having somebody to try get like their thumb in there or their elbow and like really put a lot of pressure and also create a lot more essentially like capillary breakdown. The needle is just so small that it can be so much more precise that it doesn't cause as much damage, but does cause a better reaction in terms of improving pain management. And so I always refer people to, I use it. But again, there's different types of techniques. So you always want to ask questions of like, what is the technique that you utilize? Because there's like essentially a pistoning technique where like they'll put the needle in and they'll like slowly pull the needle in and out to kind of reposition and like retarget different areas. That technique can actually be very painful for some people, especially if,
yeah.
So I don't typically recommend like somebody going that approach, especially if they're already acutely in pain or they're acute on chronic and like their pain tolerance is lower just because they've been in pain for so long. Jordan, the technique that he utilizes is he'll typically find two spots that are kind of trigger pointed. And so the muscle density of the tissue essentially feels different. We can feel that with our hands. That's what we're trained to do. And so he'll put the two needles into those different spots. And then he actually connects electrodes. And it's essentially like an e17 machine that creates small little muscle contractions with essentially the electrodes on the needle into the muscle. And so he turns up the dial very, very slowly, very, very lightly to the point where your muscles will just start to twitch around the needle. And this just, again, further helps them relax and helps them actually, again, do their job. And it's, again, very therapeutic in terms of much more tolerable. I've had a lot of, again, clients that have had dry needling in the past, not had a good experience, referred it to him, and he's taken care of them. And they're like, this was amazing. This is so much better of an experience. And I actually feel a lot better.
Okay, that's fast. I mean, now I want to do an episode. Excuse me, I just hit my knee with my desk with my knee. An episode on dry needling. That's really interesting, and I feel like a very good
get him
segue.
on for it because one, like his accent will be great for it. He's Australian, but he also will be able to better explain it. He actually teaches the course for the clinic that he works at, so he's very much like in it and understands it so much better than even I do because he specializes in it where I have not actually gone through the course to specialize in it yet.
Well, listeners, stay tuned. Coming to an episode in the near future. That's a good segue, I think, to talk about our main topic, which is coming back, dealing with running after an ankle sprain. And maybe dry needling is part of that rehab, but let's start at the beginning and talk about the ankle sprain. And let's talk about why we decided to talk about this very specific thing, not like, kind of injury in general, but ankle sprain. Why? Yeah.
So I was actually going through a period of like training for a couple half marathons that I had for, the spring season. I've been training for 20 years now. So me saying like I was going to run a couple of half marathons in a very short span of time was realistic for my experience level and my training volume. I'm going to throw that out there right at the start. But I was going out for my last workout, which was just like a handful of like 1 minute pickups at race pace. And it was, I think 3 or 4 days before my race. I usually take a first lap with my dog around the neighborhood. And if anybody listening to this follows me on Instagram, you know that my dog is reactive. He is a rescue. And it was one of the first nice days in April around here. And so everybody was out and all of the dogs were out. Me trying to avoid the dogs, I decided, I'll just go in the trail that's around the neighborhood and kind of avoid seeing other dogs there. I've gone on this trail so many times, never had anything happen. I just go really slow. I watch my footing. And I just happened to step slightly wrong at one point in time. And my ankle essentially went inward underneath me. And I heard a snap pop sound, immediately like realized in my brain what happened and like tried to take another step on that foot and it like would not take any weight, dropped to my knees and like had to take 5 to 10 minutes to like actually breathe out because it was so painful. So yeah, that was April 3rd. My race was April 5th. So it was April 2nd, April 3rd, that my injury, I know it happened on a Wednesday. That's when I have. So I'm almost, I think 9 weeks post, since spraining my ankle.
Were you concerned that you broke it? Like that would be alarming. Yes.
Yeah. I was actually very concerned because I had never heard, I've tweaked my ankles and probably many runners can relate to this. I've tweaked my ankles so many times where you just like feel it slightly roll and you're like, oh, that didn't feel great. So I've tweaked it so many times that like, that doesn't necessarily concern me. Usually I have some soreness in the lateral musculature and like tendons the day after, which I can explain what that is, as well. But this sound was very new to me. And I was like, that doesn't sound too great. So I didn't think that like I like, literally like broke the fibular, which would have been like the lateral bone in your lower leg. But I did think that I potentially caused an avulsion fraction, which is where the tendon that attached to the fibular head, or ligament, sorry, that attaches to the fibular head would have pulled at the tip of the bone so hard that it would have taken some of that bone off. And so I was very nervous about that because I didn't take my shoe off first. So after I caught my breath, I ended up calling my fiance to come and get me because I had the dog with me and I was like, all these dogs are out and I'm I was only a half a mile away from home, but even a half a mile away from home, not really able to like walk very steady. And if there was another dog and he pulled, I was like, that is risking me essentially having an even worse injury. So I'm like, I just need to sit on the side of the road until you can come and get me and drive me this half a mile away home. but I didn't take my sock and shoe off, essentially thinking of it as like a tourniquet, and preventing an extreme amount of like swelling to the joint in the area, which is totally normal. Swelling is a byproduct of the inflammatory process, but I wanted to limit that for while I was still like out. And I didn't take my shoe off or my sock off until I got home. And then I saw how big my ankle was, which was very large. It was already a baseball on the side of my ankle. And I was like, okay, that was a lot. There was no like outright bruising that comes a little bit later. But it was definitely very swollen. The pain actually did increase after I took my sock and shoe off, because again, I essentially released that tourniquet and allowed more blood and more pressure to come into this very small area. Again, very common, but can be very alarming in the moment when your pain scale all of a sudden spikes up, which is exactly what mine did. So once we were able to kind of get my pain under control, which we did we did put some ice on it just to kind of help my pain come down, not to try to take away the swelling. That's also an important thing. But for literally 20 minutes, take my pain down. And then I was able to wrap my ankle with a compression wrap called Coban, which you can get at a CVS store. It's just self-adhesive wrap. And we did like a figure 8 wrap around my ankle. And then we elevated it so that it was slightly above my heart, and so that it could kind of just like calm down a little bit. And then I took Tylenol as well, which took about 30 minutes to kick on, not ibuprofen. There's a trend going around with ibuprofen in runners. So like,
can I ask why Tylenol, not ibuprofen in this situation?
Yes, absolutely. So again, I'm being very specific as why I used ice and why I used Tylenol, because I wanted the inflammatory process to work as much as that was increasing my pain, because the byproduct is swelling. It's not the inflammatory process that I want to stunt. I want to manage the swelling, because that is what's increasing my pain. When we have increase of swelling from the inflammatory process doing its work, it essentially kind of puts too much pressure in the area, and your pressure receptors are what are sending signals to your brain that there's something wrong, and like there's too much pressure in this area, which you then perceive as pain. Same thing as like if you're like touching a stove, it's just your heat receptors that are telling you that you're touching something really hot, but then they get overheated, and that's what you perceive as pain, because you're not supposed to touch something that hot, and you're not supposed to have that amount of swelling in such a small area. So I didn't want to use an NSAID or an ibuprofen, Motrin, aspirin, any of those things, because those would essentially start to decrease my inflammatory process. So I wanted to make sure that I avoided those things for at least the first 2 weeks. If I was still having some like chronic swelling that I wasn't able to manage after that point, then I could possibly utilize anti-inflammatories. But for the first 2 weeks, I wanted to manage my pain through essentially a different receptor, which is what Tylenol works on. And it essentially doesn't stunt your inflammatory process. It just helps to reduce your pain your pain perception. And so didn't use ice after that first 20 minutes until Tylenol essentially kicked in. And then I stayed on extra strength Tylenol ahead of time. But that's something with kind of working through an acute injury. You want to stay ahead of your pain. You don't want to let the pain kind of kick on, because then you're going to be kind of like hurting for a bit and not able to kind of work through that. So I was on a regimen of Tylenol every like 6 to 8 hours for the first like 48 to 72 hours. And then I was starting to just notice, I slept a little bit longer. I actually went 9-10 hours today before I ate and took Tylenol. So I probably can push that a little bit. And your body just gives you those signs slowly over time.
So what is the actual diagnosis? What did you do to your ankle?
So it's hard to like say with actual definitivity, because I did have previous history of like tweaking my ankle. So if I went and got an MRI of my ankle, chances are, it would show that there's like a lot of essentially like chronic versus acute tearing that has happened to like ligaments and tendons in that area, which again, common and can heal. A lot of people worry about those things, but they can heal, they can adapt, and they can increase in terms of their load tolerance. But we decided after my pain came down that it would be best to see if my swelling could come down over the next like 12 to 24 hours before getting an x-ray. Because sometimes if your swelling is extreme, that can mess with the x-ray image. So we waited until essentially mid-morning the next day to go get an x-ray, just clear and make sure that there was no fracture, which the x-ray tech actually was just like, do you want to see your x-ray? And I was like, actually, I do, because I'm a physical therapist and I actually can read these. And there was no sign of an x-ray, but we did wait for like absolute clearance from like the radiologist that read it a couple of days later. And there was no fracture, which was great news. So based upon my symptoms then and the amount of swelling and bruising that then did set in, we're assuming that it was a partial tear, which would be a grade 2. The tricky thing with partial tears, though, is it's anything under 100%. So like I could have torn 90% of it, and it's still considered a grade 2 tear, where essentially a grade 1 is there's a little bit of like a stretch injury, but there's no actual like big tear. And so partial tears, it could be up to like 95% torn. And then a full tear is 100% torn. So we're thinking that it was probably a pretty severe partial tear, lateral ankle sprain. And that definitely meant that I was out of running for 3 to 6 weeks, completely. And it all depended essentially upon my pain tolerance and like how I felt I could push my ankle from there. Unfortunately, that meant that I wasn't racing that weekend, which I knew as soon as my injury happened that was not happening. And the other races that I had actually signed up for at the beginning of May and mid-May, that those probably were not going to happen either, which I ended up pulling out of both of those, unfortunately. But
So what is the definition of a sprain then?
So a sprain versus a strain. Sprain is for essentially ligaments and tendons. So your connective tissue, essentially the kind of like white fibrous tissue that we see connecting either bone to bone, which would be a ligament, or a tendon, which is connecting muscle to bone. A strain is essentially a tear in a muscle fiber. So if you strain your hamstring, that is a tear in your hamstring. Where if you sprain like your hamstring, like you get a high hamstring like pull, that's actually technically a sprain to the hamstring tendon.
High hamstring tendinopathy.
Mm-hmm. Yep.
Ugh, seeing more of that recently. But that's a different conversation. So ankles are a place where a lot of us tend to have issues from when we were very little. I've worked with so many runners who are like, I sprained my ankle snowboarding, or I used to dance and I've rolled my ankle more times than I can count, or I tripped and fell and I sprained my ankle. Like, this is very common, sprained ankles. Do you see that? Like, talk to me about what you see with runners and their ankles, and what makes us more susceptible to an ankle injury versus less susceptible.
So I think part of it, yes, it's definitely a very common injury. And one of the reasons that it is so common is kind of like what I talked about. Like, most runners will tweak their ankles and just like keep on running. And that's actually the problem that like exacerbates the symptom when like eventually an injury does happen, because most runners will just continue to run on these things without actually addressing it. So people that experience a grade 1 to a grade 2 ankle sprain are actually more likely to experience another in the future and have chronic re-injury rates higher than a runner that, like myself, where like my sprain was extremely like on the like high end of maybe a grade 2, possibly a grade 3. And because of that, I was forced to actually like focus on rehab. Like I had to essentially stop and really focus on it. So grade 3 tears, or very severe grade 2 tears have less likely re-injury rates simply because they are actually addressed via rehab protocol versus the grade 1 and grade 2. And then I think the other like thing is people don't really think about their feet. We put them in shoes, we put them in socks, we put them in compression socks. And we don't think about actually moving our toes, moving the muscles of our feet. Again, totally other topic, but like bunions with runners, it's not genetic. It's a little bit genetic, but it's really not. It's actually a muscular thing. And like it is 100% preventable. It is absolutely something that you can work on and improve your strength with. And it does take time. That's the thing that most people, but also runners in general, hate, is that these things take time and they take a lot of dedication. As soon as I had my injury happen, I realized I was like, well, I'm definitely rehabbing for the next like 4 to 6 months, like at a minimum, at a baseline. That is the time period that I'm going to have to be very intentional about what I'm doing to make sure that my ankle is getting stronger and it's able to tolerate the things that I want to do. That doesn't mean that I'm not running for 4 to 6 months. It just means that I have to be very smart about the way that I build myself back up.
We runners, I'll say, have a reputation for being a little bit, let's say, headstrong. And you made a very specific point about why you decided to stay put and have your partner come pick you up instead of trying to make it out. But I don't think you needed a reason at all. I think you could just say, hey, I twisted my ankle. I don't need a reason to stay here. But as runners, we feel like we would literally need to have a missing leg before we had an excuse to not finish our run.
Yeah. I definitely could have probably like limped my way home. Would it have been smart? Absolutely not. I would have either risked an increase of like injury, because my dog pulled me one way or another, or I just like increased essentially the like acute onset of swelling and all of that kind of stuff, which again would have increased my pain. So there was no reason for me to do it. It was just best for me to sit.
So if somebody is out running and they go down at the ankle, what are some basic things that they should assess to understand, like, should I have somebody come pick me up, or is it okay to slowly make my way home? Because the third option, just keep going, that's not an option. Wrong answer.
Yeah, I mean, it really depends on the severity of the sprain, which is obviously hard to know in the moment that it happened. I've come on and talked about like the running camps that I work at, and these kids again go on trails in these camps and they sprain their ankles and they get up and they keep going. And so for most of them, like, was it smart for them to keep going? No, not exactly. But they're also, if you're in an area that like you can't get help, I totally understand why somebody would have to like figure out their way to be able to get to a car or whatever the situation may be. But one of the reasons that I decided to get a X-ray was because of essentially immediately after an ankle sprain, you can assess for essentially what's called the Ottawa ankle rules. And so one of the rules is like, can you put pressure on your ankle in the immediately after injury and then like subsequently afterwards. And immediately after the injury, I could not put pressure on my ankle. Now, 5 to 10 minutes later, I could. So it was a bit of a gray zone for me where I was like, well, immediately I couldn't, but then 5 to 10 minutes later, I could, even though it was obviously very uncomfortable. So maybe that meant I did have a fracture and I wasn't positive, even if, again, it was a very small one, even a hairline, I wanted to be sure. So if somebody sprains their ankle and they can't put weight on it afterwards, that definitely means that like you should have your phone on you and you need to get picked up, and trying to put as little weight on it as possible in those steps to kind of get to a safe place would be the best case scenario. There's some other kind of like indications there as well, which is like point tenderness to certain areas around the ankle. But again, there can be grays with that, especially when you have acute swelling in the first 24 to 72 hours, because you're just going to be swollen and there's going to be pain there anyways. So again, when assessing my ankle and my partner assessed my ankle, there was some tenderness in those areas that we were kind of pressing around. But it ended up just being because those ligaments and tendons had been torn, not because there was actually a fracture there. So if you do end up spraining your ankle and you are concerned, you definitely want to make sure that you get in to see a healthcare provider ASAP to be able to have this assessed and to be able to see if you need an x-ray in the first like week or so after an injury.
I also want to acknowledge that when we go down like that, I haven't had a serious injury, a serious fall while running, but I've fallen and, bruised myself. And initially there's that first like jolt of pain, like whatever you did hurts very badly. And then you breathe for a bit and then it kind of goes away and then your endorphins kick in.
Yeah.
And, I'm lucky that, like I said, I've never done anything to myself where I couldn't make my way home under my own power. But that rush of endorphins, that can mess with because you might think, okay, like, it's past, I feel better now. And you keep going and then realize, people have run on broken legs because of adrenaline and endorphins. Like it does mask how we're feeling.
Yeah, exactly. And that's like, so talking about like some of those kids that have had like ankle sprains and like they fall and they're like, oh my God, this hurts so much. And then like 5 minutes later, they're back up and they're running. And then they end up in my office like 6 hours later after dinner and their ankle is like the size of a planet. And they're like, oh my God, I didn't realize. And I'm like, yeah, it's because endorphins kicked in and like you got yourself to safety. And so now we just have to kind of deal with the consequences of it. So yeah, continuing to run after a traumatic injury, whether it's an ankle sprain or it's something else, understanding the consequences of continuing that run, it's probably going to mean that rehab is going to take a little bit longer. So if you can essentially stop, get yourself to a place where somebody can come pick you up, or even just, again, walking home, like that is so much of a better option. If you obviously cannot put any weight on it, then you need to call for either somebody to come and get you immediately or call 911 to be able to go and get your ankle assessed right away.
And I can hear the question, well, wouldn't it be better to run out so I can spend less time waiting to get treatment versus walking out will take longer? Walking's the better option here.
Yeah, walking's the better option simply because we're not going to be putting as much stress and strain through the foot and through the ankle. So when we think about, again, how much weight goes through the foot and ankle when we run, it's usually about 7 to 8 times our body weight. If we're not as efficient as a runner, it could be even more. And depending what type of shoes we have on, could be putting more. Talk about super shoes. Super shoes are going to put more weight back through that foot to make you more explosive, to make you more powerful with your propulsion. So we don't necessarily want to be putting that much stress through an area that is exacerbated already and definitely will not be able to essentially accept that load because we're asking for either that area to become more irritated or we're asking for essentially another area to compensate, which is, again, going to cause layers of things that need to be pulled back when it comes to the rehab process.
Now, I think when people hear torn ligaments, stretched tendons, those things sound a little intimidating.
Yep.
When I think of a torn connective tissue, I'm thinking of like, when you've torn the top of a gel almost off, but it's like hanging by a little thread. It can't be what happens, right? Like a partially torn or stretched connective tissue. Is it going to look like that?
It actually can. Yeah, technically it can. So how I kind of describe it, which will obviously be, use your imagination right now listening in, but essentially like interlacing your fingers together. And a partial tear would be like essentially some of those fingers starting to come apart and there being more gaps within essentially the layers of essentially your fingers overlaying each other. And so depending upon how big the tear is, that's going to be how much space is now kind of available in those tears. which is one of the reasons, one of the biggest symptoms that people complain of when they're experiencing some type of sprain or even a tendinopathy, because that's essentially just like chronic tearing that hasn't been able to heal from repetitive overuse. One of the things that they'll experience is in the morning, they'll be extremely stiff and they'll be more uncomfortable, and they'll notice that their movement isn't as mobile. Well, with those tears that occur, essentially there's just more interstitial spaces available, and overnight our bodies swell. It's simply because we're not having the compression of gravity. And so these interstitial spaces around our joints, around our tendons, around all of these different structures essentially take on that extra fluid. And so now, again, those tendons that have a little bit of like tear have extra fluid in them, more pressure, more pain, more stiffness, more discomfort, initially in the morning time. And that's one of the reasons that after like taking a couple of steps, they're like, oh, this feels better. And it's just because you've created a pumping action to get that extra fluid back out of the interstitial spaces, and into your lymphatic system or into your blood system. And like, you're able to filter that out.
That is fascinating. I did not know that's what caused that.
Yeah.
And that makes total sense.
Yep.
So if you had torn the ligament totally off the bone, would that have been a surgery to fix that?
It could be. Yeah. It depends on what your preference is. And it really is kind of like what you feel confident in terms of your ability to go through conservative rehab. If you went to an ortho, I just actually spoke with somebody a couple weeks ago that they had also like a partial tear in their lateral ankle, and they were recommended surgery off the bat, even though he hadn't even tried conservative therapy. And I was like, you should try conservative therapy first, and then see if your symptoms improve, and then see if you should approach the surgery as essentially a last option. So yeah, why I say surgery is like a necessary evil is simply because like surgeons, orthos, they understand how to essentially put things back where anatomically we know they belong. But that doesn't mean that they are teaching your nervous system, your musculoskeletal system, like how to reutilize those things after injury. And so a lot of people see surgery as essentially, oh, it's fixed. Like I've put everything back where it belongs, so it must know how to work. And that's not how the nervous system works. Our bodies are intercomplex systems that have to communicate with one another. And when there's essentially an injury in place, it takes time for that nervous system essentially to register that like we can utilize and we can fire the muscles and essentially respond with like the different complexes around like the tendons and the ligaments at the same load and same intensity that we just were. So I really recommend anybody with any injury that you have, always try conservative therapy first, because research consistently shows over and over and over again that starting with conservative therapy is going to get you to a better place faster than going the surgical route first. With any surgery, especially with something in the lower limb and trying to get back to running, you're easily looking, unless you are a professional athlete and can literally work on this round the clock, you're easily looking at like a 6 to 8 month span of essentially returning to running, simply because of essentially the restrictions that are in place. And I say 6 to 8 months because yes, maybe after 12 weeks, you can start to incorporate plyometrics and you're maybe starting a return to run program. But in the actuality of how long it will take you to get back to where you just were pre-injury, it's going to take an increased amount of time. So like for myself, I'm looking at a 4 to 6 month span. If I went and had surgery, it may be 8 months, it may be longer, because there's going to be a period of time where either I would have to be partial weight bearing or non-weight bearing completely. I would have to be in a boot. That's going to create more muscle atrophy because I'm not going to be able to use my ankle. So would so much rather actually utilize it and actually learn how to load it again and try conservative. And if you don't find the right PT, keep looking, keep trying to find somebody that is essentially going to meet you where you're at. Not all PTs understand endurance athletes. Not all PTs understand every single type of musculoskeletal injury. I can tell you based off of my experience and what I've been focusing on, my understanding of upper extremity injuries is not to the same level as somebody that treats that all day long, somebody that works with baseball players, let's say. I'm not going to be able to work with a baseball player the same way that I'm going to be able to work with a runner. And that doesn't mean that I'm any less of a professional. I just know what I know, and they would know what they know. So you got to make sure to ask those questions when you're finding a professional that can actually help you with your injury.
Now, obviously, in some cases, surgery is totally unavoidable. You have to have it. But it sounds like in either case, you're also going to have to do some physical therapy.
Yes. Yeah. Yeah. And like sometimes, again, like this is where I just really reinforce for people to advocate for themselves, whether they're going to go through a cash-based model working with a physical therapist, or they're going to go through the insurance base, especially if you're going to go through the insurance base and you're going to get surgery. Advocate for yourself and tell your surgeon that you want physical therapy. They will write you a script. And if they don't, go to your PCP and tell them that you want physical therapy. I want to say I don't know why orthos wouldn't recommend physical therapy, but honestly, there have been instances in the past where orthos have straight up refused to write a script for physical therapy, which I think is just silly. And so I just tell my clients, like, well, go to your PCP and they will write you a script. And get essentially that continuation of care. It is so important because yes, they'll put everything back in place where it needs to be. But a physical therapist is what's going to help you understand, or help your body understand, how to slowly increase that load tolerance, and also help increase that communication pathway from your brain to wherever the injury is, so that you're able to better, essentially, how I like to describe it is like a 4x1 race. So a baton handoff. All of these different parts of your body should be communicating with each other by handing the baton off to the next thing. So when your foot hits the ground, it needs to hand the baton off to your calf, and then to your knee, then to your thigh, to your hip, to your lower back, to your opposite rib cage, to your shoulder, all the way up to your neck. If something isn't communicating right, it doesn't essentially allow that baton handoff to be as smooth as possible, the next thing is going to have to pick up the slack, or the next thing. That's where these compensation patterns come into play. And sometimes that can be all on the same side, which is why some people will be like, my left side is always the side that I have injuries on. Or sometimes it'll pinball back and forth. So I can use myself as an example. As I'm ramping back up, my right knee has been a little bit more achy than it normally is. And I've had patella tendonitis in that knee in the past. I have Osgood-Slaughters in that knee. So if anybody knows what that is, it's essentially, I have more of a big bony prominence on my shin bone, where my patella attaches to, my patella tendon attaches to my shin. And so that increased arc essentially results in me having more likelihood of like essentially tendinopathy because of the increased friction that can happen there. But because my right ankle is where I injured myself, sorry, I might have said my right knee, my left knee on the opposite side has been what has been more achy recently, simply because I'm kind of trying to manage load as I'm slowly ramping myself back up.
So how the heck do you treat a sprain like this?
Yeah, so where we started, and I was definitely like all runners, there was a level of me like trying to be stubborn right off the bat and be like, no, I can still do stuff. And so my partner had to kind of like rein me in. And I told him that he was going to need to do that. Because if I just like kind of treated myself, which I could have, I probably would have pushed myself a lot harder, but my body kind of gave me the signs that I needed to pull back after the first couple of days. So once I knew that there wasn't a fracture, I knew that I was kind of safe to start building up my walking tolerance. And so that really just started like walking in my house and trying to really kind of be intentional about like heel to toe, trying to actually move my ankle and allow as much weight as I felt comfortable with. the first like 24 hours was me like furniture surfing. So I was like using stuff around me to put a little bit of extra weight through. I also got a compression sleeve to wear to help with managing swelling, and a very supportive, like essentially what we would call a triplanar ankle brace. And so there was lateral stability straps, there was a figure eight strap, there was a high ankle strap, and then there was laces, all to essentially put as much support around my ankle as possible. And so I was using that the entirety of the time when I was up and moving around to offload my ankle the first couple of days.
So you were wearing that, but your walking that you were doing, was that you took the brace off?
Nope, I kept the brace on.
Okay.
Yeah. For the first week, I had the brace on pretty like essentially from the morning when I woke up until I went to bed, because I did want to try to be moving around as much as possible. So in between calls with clients, I would just try to walk around in my house. And then I eventually progressed into the neighborhood, and slowly built up from that first week from like essentially I think like 5 minutes to like 20 minutes. And that just was very slowly over time. It was very, very slow though. My walking was very, very slow. After the first 24 hours, all I essentially did for rehab in that first 24 hours was like ankle pumps. So lying on the couch with my ankle essentially elevated, I would just try and move it as slowly as possibly up towards my head and then try and point my toe. And it was very restricted. Wasn't a ton of room for it to move because it was still so swollen. So it was mainly just to try to get a little bit of like blood flow through there to get, again, that pumping action. That's why I was also trying to walk as well, those little 5-minute bouts. And then
let me ask you a little bit more.
Yeah.
So at this point, kind of the first week as you're going through this initial slate of exercises, what level of pain is appropriate?
Mm-hmm.
And when would you have stopped, said, okay, I'm doing this exercise and now it hurts too much, I'm going to stop? What is too much?
Yeah. So there's two kind of sides of this like monitoring pain coin, which is a great question. It's one that I get very often. It's not only the intensity of pain, but how long that pain lasts for. And so those are the two things that I always tell people to monitor. And so I use like a green, yellow, red light system. Green for pain intensity is 0 to 3. So 0 pain. Yeah, you can proceed. And up to a 3. Essentially, that range is at a low enough level that it's essentially just your brain being like, I don't feel super confident about this. We maybe should like just be mindful. Like, are you sure about this? It's just letting us know that it's not feeling super safe. And that is okay to push through because we can gently just kind of encourage those neuromuscular connections and the muscles to be like, okay, no, we're fine. Like, and sometimes with that, it actually improves our pain because we're helping to reduce swelling. We're helping to actually increase muscle activation, which often gets shut down after an acute injury. So there's a reason why, like, you sprain your ankle and you can't, like, you physically can't push through that foot. You can't do a heel raise. It's because your brain has shut down those muscles. It's like, these are not safe to fire right now. So we're shutting them down so that you can't do any more damage. You can't pull on these tendons or ligaments that are already injured to this degree. The other side of that, again, is the time span. So green, essentially, in terms of how long you're experiencing the pain for, is you do whatever movement you're doing. So say I was pumping my ankle. If I had any pain with that, which there was some tightness and tension, I can recall that. If that continued after I stopped the movement for, like, say 30 seconds to 2 minutes, that's in a green kind of zone. Very normal, very expected for something that I'm reintroducing a movement that it's not super comfortable with right now. The next level, yellow, would be pain ranges between a 4 and a 6. And then in terms of time, it would be if that pain continued to last for a couple of hours after the activity, which that can be actually very, very common for somebody that is experiencing, like, again, a sprain or a tendinopathy. It's usually not during the activity, but it's when they're cooling down or afterwards, they've been sitting for a while and then they get up and they're like, oh, I can feel that area. So that's usually pretty common. And if it is a tendinopathy or if it is a sprain, then we just want to make sure that we monitor the volume, the intensity, the like external variables. Say like somebody is tolerating running at this point, and for some reason, like hills are what irritate them. Well, maybe we need to keep them on flat ground, or the inverse. Sometimes running downhill and flats are what irritate people the most. And hills, they can do as many as they want of. Maybe we try to like modify that a bit. So the yellow essentially is just caution. Proceed with very, very extreme caution. Usually if somebody is in a yellow, I don't kind of change the variables all too much. For me, that says your brain needs more time at this level of rehab, of running, of whatever it is, that you need to learn how to process this better and do this better before we can then proceed. And so I usually don't change too many things, or if anything, again, I do back off slightly and tell them to go through less range of motion, or to hold the exercise for not as many reps, or to hold it for less duration, or if they're running, again, changing the variables of what they're doing in terms of duration, intensity, or the external like terrain factor. Do not proceed. Absolute stop is essentially anything above a 7. So if you are getting a 7 out of 10 to a 8 out of 10, 9 out of 10, 10 out of 10, your brain is screaming at you. And I'm saying your brain because it really is your nervous system that is perceiving all of these threats. Your nervous system is telling you to stop. It is telling you that it cannot tolerate what you are doing. It has lost essentially the capacity to do what you're doing, and you aren't necessarily creating more damage. A lot of people think that pain does increase essentially the amount of damage that you're doing, but it is a very high instance that you could either increase the injury that you already are experiencing, or you're going to create an increased compensation pattern that's going to cause more pain somewhere else. So 7 out of 10 or above, do not proceed, completely stop. You do not get to go past go. You do not get to collect $200. You're shutting it down, and walking or not continuing with that exercise. And then the time span for that, if we're thinking from like how long pain is lasting for, if your pain is lasting for more than a day. So say you do something and that pain onsets and it continues to last into the next day, that's a red flag sign. That's a red light sign that something about what we did was not tolerated well. And we need to either modify that or completely remove it so that you can tolerate it better and you can proceed forward.
So after you've gotten past the, building up your tolerance to walking, what is the next step?
Yeah. So during that time, I was working on range of motion. At first it was active assisted. So what that means is I looped a resistance band around my ankle and I slowly worked through specifically plantar flexion and dorsiflexion. And I worked through that for the first 24 to 72 hours. I didn't even touch the other two planes, which are inversion and eversion, because that was the direction of my injury. And those were the most restricted. And that was essentially I didn't want to essentially cause more injury to that area. And so it's not clinically appropriate to essentially start doing things like that. So for the first couple of days, it was active assistive range of motion. Once I felt like I had enough control, essentially sitting, to kind of move my ankle on its own, I started doing dorsiflexion, plantar flexion without the band, and then essentially against the band for a little bit of resistance. And then started to incorporate active assistive, inversion, eversion, and followed that same progression there. Once I started having, again, more control, range of motion was coming back to normal, which I was kind of very obsessive about making sure that I was getting range of motion back as fast as possible. My goal was to get back to running as soon as I could. And I am privileged in the fact that I understand these things and I have the time to be able to dedicate to that. But I got my range of motion back probably within 5 days after the injury. It wasn't 100%, but it was like 95% there. And pretty much what was limited was just limited by the acute swelling, which I still have swelling to this day. And again, I'm like almost 9 weeks post since injuring my ankle. And that's again going to be very common because of the type of injury that I had and those tendons in their kind of capacity for increasing the interstitial space swelling that happens. The first type of movement that you want to focus on with, I think, any acute injury is my kind of clinical preference, but especially with a tendon or a sprain specifically is isometrics. These specifically target tendons and connective tissue in a different way that like concentric and eccentric contractions. Eccentrics are also good for tendons, but they're more aggressive. And so we like to start with isometrics where we're essentially holding a position and creating a contraction and trying to drive essentially that neuromuscular control, but also they help to reduce pain. And so those were what I kind of focused on now. Again, with the band, I was doing plantar flexion and dorsiflexion isometrics. And then eventually I started to add inversion and eversion isometrics with the band. I was slowly starting to try to incorporate like half kneeling, essentially weight shifts of like me bringing my weight over that foot, pressing my foot down into the floor. Once I was comfortable with that, I started doing some off the step heel like holds. So not actually heel raises, but just like holding my heels off the step and trying to get the muscle, again, connection restored between my foot and my brain, which was very hard at first. Like that's where we see essentially muscles start to kind of shake and quiver. That's your nervous system trying to drive these connections again, and it's not able to necessarily complete those.
That's fascinating. Obviously, as a PT, you are doing this to yourself. But, for somebody who's listening, hoping for the secret sauce to help them work through their own ankle sprain, the recommendation is you have to go to physical therapy for this.
Yes, absolutely. Yeah, I would absolutely recommend somebody work with a physical therapist. If you see a physical therapist for this, I don't want to say the rehab is very straightforward, but the direction of which you can go in terms of the acute phase is pretty kind of like laid out of what we need to accomplish in terms of restoring range of motion, again, increasing that muscle co-activation around the ankle through isometrics, and then starting to do more dynamic movements of like just like heel raises and things like that. But then where the layer kind of like gets a little bit more complicated, which is why you want to make sure you have a professional that understands the demands of running, is we don't want to just make sure that we treat the ankle, because there's going to be some muscular kind of like shutdown or communication like errors happening up the chain. For the longest time, I was actually very aware. One of the things that I was doing was also step downs. So lateral step downs off of a box. And if I did them on my left side, which is my non-injured side right now, I could clearly feel not only my foot and my calf working, but I could feel my hamstring. I could feel my glute. It's only been maybe in the last like 2.5 weeks that I've finally felt my right side getting that same level of activation back. Simply just because, again, those communication pathways get shut down when an injury happens, and it takes time to restore that. Doesn't mean that like I shouldn't have been doing it. It just takes a lot of time and a lot of repetition, which is actually where like doing PT exercises, choosing to do them more frequently throughout the day and doing like shorter sets or reps actually will have a bigger like pathway of growth, because you're just exposing your brain to those movement patterns over and over and over again that they get to learn faster.
It's a very interesting part of physical therapy where you are essentially trying to regrow these connections. Mm-hmm. And I've been tripped up by this too with PT, but it doesn't necessarily feel hard when you're doing these exercises. And I think often as runners, we're used to the things that we do and just being really taxing. And if it's not taxing, we think it's not doing anything. But you're describing a set of exercises that is doing something very specific. It just doesn't feel like maybe what you're used to feeling.
Exactly. Usually what I tell people to expect in the first like 4 to 6 weeks of working with me is like, these exercises aren't going to feel like muscularly hard. Like you're not going to be like brute strength trying to work yourself through them. But what they are going to be is more coordinative. So you're going to have to put a lot of time. You're going to have to put a lot of patience and attention to what you're doing to actually get out of them what you're trying to achieve, because you're just trying to restore that coordination pathway. Thinking about it like from a way that runners can understand, like think about how you're working on your form and being intentional when you run, and you're not just like kind of plodding along, but you're actually trying to like swing your arms and really kind of have a quick cadence. You have to think about that. You have to practice that. And so we're doing the same things with these exercises to restore those connections so that you have that efficiency again. Because the first time that you go back, otherwise it's going to be very kind of disjointed.
So something I haven't heard you talk about, because you did say your goal is to get back to running as soon as possible. That is the ultimate. As soon as you went down, I'm sure you were thinking, all right, how can I make this get back as fast as possible? But that's every injured runner's goal is, well, I just want to get back to running as soon as possible. But I think the way that you are describing it, like your intention about what that means for you is different than somebody like me. I might say, like, I just want to, as soon as my ankle starts feeling better, I'll be able to run again, and kind of have that be the end of it. Because in my mind, I can run again, case closed.
Yep. And that's not necessarily the case.
Probably not how we should be approaching this.
Yeah. Honestly, for most rehab scenarios, like you're going to, if you're following your rehab plan appropriately and you start working with a therapist relatively soon after injury onsets, like most people will start to see pain improvements or pain completely resolve in like a 6 to 8 week span. But we know from research that even with pain kind of dissipating, that doesn't mean that essentially the load tolerance or the coordination and stability control that we need has been built up at that point. That takes 8 to 12 weeks to really kind of sustain. So there is this kind of like post-pain period where we need to continue to work on that. And I usually say for runners that is more than just 12 weeks as well, because the level of intensity of what we do in the single leg control that we need takes time to build. And so if we're building up this foundation from a very low level to the highest level possible to sustain not only running X amount of miles per week, but also doing workouts in a long run or a race, or incorporating some technical trails, there's a lot of layers to that we can work on for an extended period of time that eventually just becomes like strength training. And that's where like we see that bridge and that gap. And that's kind of what I will say I'm very good at in helping runners kind of create that bridge to get them to where they need to be. But yeah, I was not in pain from my ankle anymore after like 2.5 weeks. I wasn't really experiencing any pain. There was some stiffness, but there wasn't any pain. Even when I went for my first run, I didn't really have any pain with it. I could just tell that it was a lot weaker than my opposite side. And even then with my first run back was 2 minutes of running, 2 minutes of walking. So that's why, again, like it's not me just coming back and, oh, now I'm able to do a 13-mile long workout like I did just before I sprained my ankle. I'm probably not going to be able to do that until probably like August or September at this point. Like realistically, I'll be able to run a certain amount by then, but I'm not going to be able to do that length or that intensity until a few months from now.
Now, the timing of your injury is probably the worst timing that we can have an injury pop up or have an injury occur as runners. It is literally 2 days before you had a race on the calendar. And you and I both know that we have worked with plenty of people who would have tried to run that race anyways. And I would love to hear kind of your thoughts on being in this place of really being able to focus on and prioritize the things that are important to get you back to running, while also dealing with kind of the emotional disappointment that we feel when we are, I planned for this for months. Now I can't do it. And it's devastating.
Yeah, absolutely. One of the things that I did in the first couple of days after, and like it took me a little bit to kind of like register what I was truly feeling as well. And also for the degree of which I was going to have to like actually pull back, because there was a thought in my mind initially after the injury. I was like, okay, well, if it's not fractured and I can get back to running at a certain rate relatively soon, well, maybe I can still run these other half marathons. Maybe I won't be able to race them, but I could maybe run them. And then I quickly kind of realized like, no, that's not going to be an option. And I just need to kind of push essentially these things to the side. And so that took me a couple of days to actually kind of like realize the gravity of the situation. And that's one of the reasons why not to rush into anything after an injury happens, except for maybe starting to focus on rehab. And so I think a lot of times what typically happens is, yes, some people will push through, and I've definitely coached people that are in a certain place in their rehab journey, and like their pain is not completely resolved and they have a race on the calendar and they want to run it no matter what. And so I just am very upfront about essentially the cost of what that's going to do. And I'm like, you are an adult, you can make this decision yourself, but this is what the repercussions of your actions will be. I totally understand that there are some races where we need to do that. And that's where we feel like we want to put all of the coins into the basket. But just know that essentially this is going to be the repercussion, that afterwards you're probably going to be unable to run and in more pain for an extended period of time. And then the other factor is oftentimes, I just lost my train of thought. My dog is at my lap and just like begging to go outside right now. So, but the other factor is, a lot of people are like, when I posted about my injury, they're like, oh, don't worry. Like you'll get back out there. Like you will be able to race again. There's always another race. And I appreciated what those people were trying to do. And I do appreciate everybody that reached out to me and like wished me well and like tried to send like words of encouragement. But what I then also posted later about was like, it had nothing to do with like the fact that these races weren't going to happen. It was all of the months of training and all of the financial kind of like stuff that goes into it. Like now being an adult and understanding essentially all of the things that I have to put in to make this happen for myself while running a full-time business, and having a job and having essentially a life outside of running. It takes a lot of time. It takes a lot of sacrifice. And it's hard not to feel after putting in all of those months of work that like, I just lost everything that I put in. And that's not necessarily the case. That's how I felt in the moment. That doesn't mean that it was true. And I kept kind of reminding myself of that. Like you can feel this way, but you know that that's not the case. You will get back to this fitness level one day. It may not be in a certain timeline that you expect, but you've always been able to kind of get back to where you want to be. And fitness does ebb and flow. So like, this is just what was meant to happen right now. And the thing that I've learned in this process of running for now 20 years, and it's been since 2019, since I've run a PR, and I was actually in a place heading into these races thinking, oh my God, it might actually happen this time. Like I'm in a place where like, I actually feel fit enough that I could potentially do what I was looking to do. And then to not even get the chance to race, I was like, well, this is poetic in so many ways. But what I've learned essentially from this process of not PRing in so long and now having this injury pop up, and all of these other life things that have like, quote unquote, got in the way of my running is like, what else am I going to do? I'm not going to stop. I love running. I love what it does for me. I love the community that it's built around me. I love the fact that I've made my career supporting runners and helping them with either getting out of pain or improving their performance. Like I love when people my clients text me and let me know how their races or their runs went. Like that makes my day. So what am I going to do? Am I just not going to run anymore? Am I going to quit? Absolutely not. I'm just going to figure out a way to get back there in a way that I can. And that was kind of the juxtaposition that I was in, where it was like, all right, allow myself to feel what I needed to feel and feel bad for myself at times and feel frustrated that this is where I was in a week after doing, again, one of like the hardest workouts that I've done in so long, and feeling so fit. And like now I'm able to only walk around my block for 20 minutes at a time. And then also be like, all right, this is what I can control. I can go back and I can do my exercises. I can do this, this, and this right now to try and promote healing and try to help my body get to a place where I want to be. And I'll say the last thing that I probably did was communicate with my partner, because he is such a wonderful human being and so upbeat and cheerful that like when he sees somebody sad, he tries to like cheer them up. And I just had to be like, you need to just let me be sad. Like, if you see me sad, don't try to like say anything about it. Don't try to make me be happy and like try to give me the silver lining of the situation. Just let me feel what I'm feeling. And by him allowing me to do that, I was able to just feel sad on the days that I needed to. And then it allowed me to, again, whenever I did feel sad, well, I then was able to be like, this is what I can focus on. And I was able to focus on that a little bit more intentional. I think not maybe the worst thing is maybe not doing anything at all, but just kind of like giving up on fitness as a whole if you can't do the one thing that you want to be doing. So I obviously couldn't be running, but that didn't mean I couldn't lift. And could I do all of the lifts that I wanted to do? No. It took me a couple weeks to get back under a barbell in the gym as well, but I was able to still lift dumbbells. I was still able to do a partial squat. I was still able to lift upper body. And within a couple of days from running or from having this injury, I was able to get onto a bike, and an indoor bike, not an outdoor bike. I wouldn't recommend an outdoor bike. Too many risks of falling with that. But indoor bike, I was able to essentially just like get some movement in that way. And so even though it wasn't what I love to do, and I do love lifting in a way, but the freedom that I guess I feel from running is very different, and many runners feel that way. I was still able to move my body. And I think that definitely helped from a mental aspect of being able to focus on my rehab and still feeling like I was putting some effort forward and maybe maintaining a little level of my fitness. I was obviously going to lose fitness no matter what, but I was able to at least put some intention there. And that helped with me being able to focus on rehab and moving forward. That was a really long-winded answer, but
no, it's good. And I know we have to wrap up because you have a dog that needs to go on a walk. But I want to kind of briefly ask about the two big things that I see. I want to call them mistakes. I see the two things that I see most commonly with runners who have an injury that's taken them out of the game for a couple weeks before they're able to start slowly reintroducing running again. And by that, I mean, like these are, significant injuries. Is that one, there's obviously probably with a lot of the emotional response, a huge focus on trying to maintain their current fitness, even when you can't run. So this is like, oh, well, I can't run at all, but I can spend all of that time cross training or lifting or on the elliptical, or I'll find the one exercise that keeps me relatively pain-free and just do like a ton of that. So I see that happen. And then I also see after the initial grieving period, like I'm injured now, blah, blah, blah. This sucks. Find kind of where you are, that like 8 to 10 week range seems to kind of be another wave of like, this is taking longer than I thought. Now I'm depressed again.
Yep. Yeah.
I would imagine you probably see some of those things as well.
Yeah, absolutely. I mean, like where I am right now, it's like I I'm so grateful for how I've been able to come back into running. And I have been able, I was able to get back into running around 3 weeks after my injury. And again, it was starting off with 2 minutes on, 2 minutes off. And I slowly built that up over the past couple of weeks, where now I'm able to get to a point of I can run 2 miles continuously. And I'm taking 1 to 2 minutes walking in between. And I can do that actually at a pretty decent volume based on essentially my experience and where I was beforehand. But there's still some contingencies. I can't do too longer-ish intervals back to back, because if I do, my ankle just doesn't have essentially the stability and the endurance there yet to handle those back to back loads. So I'm only running 3 times a week right now, which probably sounds like a lot. Again, I was very determined in terms of speeding up my quote unquote recovery, but I still have a long way to go. And looking back at what I was doing to where I am and where I want to go, I'm planning out the next month of what my training's going to look like. And I'm going to try more continuous runs where I don't take kind of specific walk breaks and only walk break as needed. That's probably going to take me through the month of June to get to the point where I'm not having as much compensations, and I'm not having as much fatigue buildup from that. And that's okay. I'm hoping that maybe by the end of June, I can do a little bit of some strides and things like that. We'll see. I might incorporate some hill strides at an easy effort before then, but it's not going to be at an intensity. Intensity probably won't even cross my training plan until maybe July, maybe August. It's somewhere in that range. I'm mainly focusing on the endurance factor right now, because that's the thing that's going to take the longest. But yeah, if you look at where you were and compare to that, you're always going to be disappointed in this process. And so you got to remember where your new starting point became. And my new starting point was the day of injury. So essentially that day moving forward, that's what I'm comparing myself to now. What was I able to do day one versus what I was able to do now is absolutely incredible. And if I'm looking at it too far out, that's where I'm going to get wrapped up in essentially comparison. But if I can look a little bit more narrow right now, that's going to help me kind of move forward. And then there was another question that you had in that as well.
Oh, no, that was great. No, we answered it. Oh, man. Well, Lauren, as always, I know we could keep talking and talking and talking. I'm so glad to hear that your rehab is going well, though.
Thank you. Yeah. I mentioned the camps a couple of times, but that's now my main focus is being able to get back to a point where I can run up in, there in upstate Vermont. And I want to be able to run in upstate Vermont on the dirt roads and on the trails. And I'm I got to get my ankle back to that. So I want to be able to handle the terrain and the volume there, which is, again, why I'm focusing on rehab the way that I am. But if anybody has questions about this, because again, we could go on for hours about all of the intricate ways that we could look at therapy for any acute injury or specifically an ankle sprain, people are welcome to reach out to me. I love answering questions like this.
And of course, you also do take patients. And
Yes.
If people are interested in not just signing up for the Revive retreat, but if
Yes.
they want to learn more about you, learn from you, work with you, where can they do that?
So website is thepersonalizedrunningdoc.com. Doc is DOC. And then same thing for Instagram at the personalized running doc. You can find me there. I'm the one answering the DMs. And if you have questions about Revive, if you have questions about how to set up a discovery call and see what program may be best for you, I'm happy to answer any and all questions.
Lauren, thank you so much for your time. I'm looking forward to September. We're going to have a heck of a good time this year, and hope your rehab continues to go well.
Thank you so much. Thank you for having me again. It was a blast.
Thank you for listening. Visit runningexplained.com to learn more. The information provided in this podcast is for educational and informational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment.